Okay, are we ready to go?
Yes, sir.
Awesome. According to NPR.org, on February 11th, 2019, quote, more than 50 people have now been infected by the measles in an outbreak across Southwest Washington State and Northwest Oregon. What could have caused this? The answer is really quite simple. The anti-vaccine movement. I would like to clear the air involving vaccines and give you facts regarding how vaccines promote public health. I'd like to do this in three ways. I'd like to talk about how vaccines support individual health, vaccines increase herd immunity, and vaccines halt preventable illnesses. So let me talk about how vaccines support individual health, how they support us, one by one. CDC.gov has a very informative article about how vaccines support the health of a baby. And here are a few things that I found from there. Diseases that are preventable by vaccine can seriously harm unvaccinated people, especially children. Measles, polio, chickenpox, other diseases that are preventable by vaccine, they can kill. They're serious. Another thing that I wanted to mention is that there aren't very many side effects to vaccines. Most side effects that you hear about are simple allergic reactions, most of which are not serious enough to even warrant going to the hospital. And when they are serious enough to go to the hospital, they have ways to help with that. And another thing, contrary to popular belief, vaccines are not linked to the cause of autism. And my source for this was Dr. Craig Oberg, who is in the microbiology department here at Weber State. I asked him if vaccines had a connection with autism, and his answer was no. I'm going to quote him. He said that the medical community has done a, quote, massive search back through hundreds of vaccination research projects to see if there was actually any connection, unquote. Dr. Oberg told me that the medical community could find no evidence whatsoever that vaccination was linked to autism at all. In fact, he said that the study which started the whole idea that vaccines are connected to autism was created with false data. So that idea is unwarranted. There's not a lot of evidence for it. And a lot of you might be thinking, but isn't it my choice about whether I vaccinate myself or whether I vaccinate my child? And this leads really well into my second point, which is that vaccines increase herd immunity. According to vaccines.gov, a simple way to describe herd immunity or community immunity is this, quote, if enough people get sick, it can lead to an outbreak. But when enough people are vaccinated against a certain disease, the germs can't travel as easily from person to person, and the entire community is less likely to get the disease. So do you see how that could be important? Do you see how the idea of herd immunity is crucial to understanding why vaccines are so important? If you choose not to vaccinate yourself or your child, the whole community faces the consequences. The measles outbreak that I talked about at the beginning, that's why. Because even people who are vaccinated, vaccines aren't 100% effective, and so we need the herd immunity to make sure that everyone is covered. Consider also people with autoimmune diseases, such as like AIDS, or there are a variety of ones that people are born with. People like that can't be vaccinated. And the reason why that is just how vaccines work. If they get vaccinated, they could have serious health problems. Those people have a really good reason to not be vaccinated. But that means they're at risk for all the diseases that come about with, that are preventable by vaccines, such as measles, such as polio. If herd immunity is high, then this person is less likely to come into contact with a potentially life-threatening disease. If the opposite is true, then this person suffers for no good reason. These diseases are scary. Vaccines increase herd immunity. And I also want to talk about how vaccines halt preventable illnesses. The deadliest disease in the world, according to MSN.com, is smallpox. And the death toll was estimated at almost 500 million. This disease was eradicated by a vaccine. Can you imagine if the attitude about vaccines then had been what it is now? It's like, well, it's kind of my choice. It would still exist today, and thousands, if not millions, of people would be dying because of it. And then other diseases which hadn't been eradicated yet, such as measles, polio, and hepatitis B, are again on the rise. And once again, that's according to MSN.com. Vaxopedia.org on June 10th of last year said there were about 89,780 measles deaths, mostly young children recently. And that's a preventable disease with the vaccine. And that's a tragedy. So once again, these diseases are scary, and vaccines halt preventable diseases. I would like to restate my 3 main points that I said to you today. Vaccines support individual health. Vaccines increase herd immunity, and vaccines halt preventable diseases. This is a serious issue, and I hope that each of you today will take this into account. We have to make efforts to be reasonable, to listen to science, and to vaccinate as many people as we can. It's not just a choice because it affects everyone around us. It's an important thing for our community. And we must remember that vaccines promote public health. Thank you.